If you feel criticized, humiliated, judged in every social interaction, you have social anxiety disorder. Hello, guys. My name is Juliana. I'm a psychology student, and in this channel, I talk about psychological disorder, mental health awareness, and just the mind. So, if you're interested in psychology as a discipline, as a hobby, or you want to know your mind, get to know yourself better, smash the subscribe button, like, and comment and share. Let's be committed. So without further ado, let's get into the video. Social anxiety disorder is a type of disorder that brings a persistent and intense fear towards social interaction. Individuals with this disorder feel an intense feeling of criticism, humiliation, or even fear of being judged by other people. Social anxiety disorder is also called social phobia. That is fear of being around people, that is of socialization. Researchers have discovered that people that have social anxiety disorder around the world is approximately 5 to 10% of the world population, commonly found among women. Social anxiety disorder begins at early age, your early teen, early childhood, early adulthood. This is when you feel anxious, you feel fear, you feel just intense fear around about being around people, about communicating, about interacting with strangers. There are so many signs and symptoms of social anxiety disorder, but I'm going to break it down into three. We have the emotion or behavioral symptoms, we have the physical or physiological symptoms, and we have the social symptoms. So when it comes to the emotional or behavioral symptoms, this involves an intense observation of oneself when you're overly self-conscious. It involves feeling of being humiliated, feeling of being criticized, fear of being judged, and so many more. When it comes to the physiological symptoms, it involves blushing, cold feet, sweating, heart raising, panic attacks. When it comes to the social symptoms, it involves interviews, meeting up with strangers, eating in public place, public speaking, just so many things. When you find yourself being anxious in any environment, these are signs of social anxiety disorder. We have different levels of social anxiety disorder, also known as stages of social anxiety disorder. We have the mild, we have the moderate, and we have the severe. The mild is when an individual feels these symptoms, but then he or she can manage themselves when it comes to being in that situation. For example, public speaking, you feel so anxious when you're talking in front of a public, but then you manage yourself, you try to be coordinated. We have the moderate and the severe. This is when the individual feels these symptoms and then is unable to manage it, leading to panic attack, leading to suicidal thoughts, leading to the individual unable to interact with people around them. Hold on. I know you are thinking, what's the difference between social anxiety disorder and shyness? It's a clear difference between social anxiety disorder and shyness levels. Three differences. One, the amount of time. The amount of time you feel anxious, the amount of time you feel shyness. Does it affect your everyday activities? Second, the intensity. What is the intensity between this social anxiety and shyness? And the third thing is avoidance. What does this social anxiety disorder is? What does it makes you avoid? What are the certain social interaction that that this anxiety avoids you from partaking, and what does shyness avoid you from partaking? Causes of this anxiety. There have been so many researches on the causes of social anxiety disorder. Some researchers believe that genetic is a cause of social anxiety disorder. Some persons believe negative experience, when we have a traumatic event in our life, it leads to social anxiety disorder. Others believe that one negative experience can lead to social anxiety disorder, and some other persons believe environmental factor lead to social anxiety disorder. This is when an individual finds himself in a new environment, unable to socialize, it can lead to social anxiety disorder. What are the necessary treatment for this disorder? There's so many treatments. If you know you have signs of social anxiety disorder, meet a clinical psychologist. But as always, I'm going to give you a self-care tips you can do every day. Number one is deep breathing. Deep breathing goes a long way. Number two is journaling, especially gratitude journal. Talk about things you are grateful about. And the third thing is positive talk. Talk positivity about yourself, within yourself, in yourself. Always be positive. Thank you for watching. See you in my next video. Bye.